Hi, I'm Beond. I'm Vice President of Clinical Operations at Beond Treatment in Cancun, Mexico. I'm also a registered nurse, and I have overseen close to almost 3,000 Ibogaine treatments so far. So what actually happens throughout an Ibogaine treatment, and how do we keep you safe throughout the process? Come, let me show you. Typically, an Ibogaine treatment lasts anywhere from 10 to 12 hours. You will be accompanied by the medical team and the nursing team that's going to be sitting in on your trip. When you come into this room, you will be laying on this medical grade bed that has many positions to keep you comfortable. You'll hear some music in the background to help also calm the nervous system. You are going to be hooked up to this cardiac monitor that's going to allow us to see your vital signs and your cardiac rhythm in real time, making sure that we are checking the physical response of your body throughout the treatment. You'll be hooked up to this IV pump as well that's going to be keeping you hydrated throughout this treatment and also making sure that your electrolyte balance is where it needs to be for Ibogaine. You will have a table here next to you that's going to come with a very handy barf bag. Some people use it, others don't. We'll see what your experience holds. Noise-canceling headphones and also an eye mask that is going to allow you to isolate from your external surroundings to truly take this trip inward the way it's supposed to be. If you want to go to the restroom, you're going to have a nurse at the foot of your bed the entire time. So whenever you need to go, just let them know and they will carefully unplug you from the cardiac machine and walk you to and from the restroom, back safely into your own bed. So Ibogaine treatment usually has two phases. The first phase is typically called the visionary phase, but it's not always only about the visions. This is the phase where the psychedelic effects are mainly present. Usually it can last from 2 to 6 hours. During this phase, you will get quite ataxic. Ataxia basically means that your coordination is going to be quite compromised. This is why your nurse is here at the foot of your bed. She or he is there to assist you with absolutely anything that you may need. After this, you'll start to notice that the psychedelic effects begin to subside. When this happens, you are entering into that second phase. The second phase is commonly known as the introspective phase. This is the phase where you are able to have conversations with yourself that are going to be very different than the typical conversations that you have when the egoic state is very present. Usually the trip ends when your heart QT segment is back to normal parameters, when your vitals are looking good as well and stable, and when you've been able to digest or have some food without it coming back up. Also, the ataxia needs to be at least 80% gone. You need to be back to 80% coordination, that you can at least walk by yourself as well, just to make sure to keep you safe. So that's when we know that Ibogaine treatment has ended. Ibogaine treatment, or the journey, usually begins around 7 o'clock in the morning. You will be taking the pills at this time. It'll take anywhere from 20 minutes to an hour for you to start feeling these effects. The journey begins at 7 o'clock in the morning and it will typically end around 7 p.m. in the evening. After this, you leave the treatment room and the nurses accompany you back to the recovery room. Or if you're staying here at the White House, back to your own room, where you will be able to get some rest, continue to draw, journal if necessary. Ibogaine can affect the heart, which is why medical supervision is absolutely essential. At Beond, safety is our top priority. We do extensive cardiac assessments. We are drawing labs as well, and we are reviewing your medications, making sure that you are absolutely a candidate to be able to receive this medicine with very little cardiac risk. At Beond, we have 9 medical doctors on site and a team of about 18 registered nurses, all of whom are ACLS certified. Our goal is to create a space where you feel safe, cared for, and not alone. From the moment that you get in touch with us, we are working on building trust. We are trying to meet everything with compassion and not judgment. We want you in these spaces to work with us on your healing and to feel seen, heard, and cared for. We will be checking in with you regularly throughout the experience, not just physically, but also emotionally, meeting any need that might be arising, whether that is helping you stay hydrated or holding your hand, helping you go through an emotional wave. We are also here to offer you grounding, comfort, and reassurance as you move through your journey. Most guests move through a very deep and emotional process, sometimes revisiting past memories, very impactful moments in life, trauma, or making very significant shifts, obtaining new insights. All of these things, very impactful, very important. This is the reason as to why we create a safe space that allows you to go deep, that allows you to do that inner work without having to feel that you have to hold on to any of the control. We're here to take care of all of your human needs so that you can truly go, be curious, and explore in that Ibogaine realm.